Lawmakers are considering a bill that supporters say will keep private ambulance services from disappearing because House Bill 400 was carried over last week and could be voted on in the House in the coming days. We 31's Corinna Shadowan breaks down what the bill would do and why supporters say it's needed now.
Ambulance services respond to emergencies every day, but some say they're not getting paid enough to stay in business. Supporters of House Bill 400 say without change, some rural communities could lose emergency coverage altogether.
If we don't do this, I believe that in the next year or two, we'll see further degradation of rural health care. Your private ambulance services will disappear.
House Bill 400 would set a minimum reimbursement rate that insurance companies must pay for emergency ground ambulance services. Right now, Alabama's rates are significantly lower than neighboring states, making it difficult for private companies to operate.
Most states are about 325% of CMS, that's Center for Medicaid and Medicare Services. Alabama runs about 145 or so. So we're way below what other states pay.
Supporters say one of the biggest problems is called treat in place. When paramedics respond to a call, treat the patient on scene, but don't transport them to a hospital. And in many cases, they don't get reimbursed for that call at all.
Without reimbursement for treat in place, about 30% of your calls where you don't transport, you simply don't get paid. That ambulance is out of service for the time it takes to go on that call, and you might miss another emergency call while you're working on a call that you really didn't need to get called for in the first place.
The bill would require insurance companies to reimburse for those on-scene treatments, which supporters say would keep ambulances available for true emergencies. Oliver also says rural hospital closures have made the problem worse, with some ambulances traveling hours to larger facilities, keeping them out of service even longer. Supporters say the goal is to stabilize ambulance services before providers shut down, especially in rural Alabama. House Bill 400 is expected to return to the House floor for a vote later this week. In Lawrence County, Corinna Shadowan, We 31 News.